would like to call upon stage Dr. Shaik Farhan, a Rashid, pediatrician, Rainbow Hospitals. Can we give Dr. Shaik Farhan a big round of applause? Very warm welcome to you, sir.
Now the topic is dengue fevers. సో ఈ సీజన్లో ఎక్కువగా వచ్చే డెంగ్యూ ఫీవర్స్ గురించి అలాగే పీడియాట్రిక్ ఇంటెన్సివ్ కేర్ ఇంపార్టెన్స్ ఏంటి, ఎక్మో యూజర్స్ ఏంటి, సో దీని గురించి ఇప్పుడు ఈ టాపిక్ మాట్లాడబోతున్నాం. సో మాట్లాడేందుకు మనతో పాటు ఉన్నారు డాక్టర్ షేక్ ఫర్హాన్ రషీద్, హెడ్ ఆఫ్ ది డిపార్ట్మెంట్ ఆఫ్ పీడియాట్రిక్ ఇంటెన్సివ్ కేర్ ఫ్రమ్ రెయిన్బో హాస్పిటల్, బంజారా హిల్స్. హలో సార్.
Hi, thank you so much for inviting me. Good afternoon, everybody. I am Dr. Farhan, pediatric intensivist at Rainbow Children's Hospital. Thank you so much for inviting me here.
Yeah.
Thank you.
Yeah, doctor, tell me about dengue. What is dengue actually?
Yeah, as I'm sure all of us must be knowing a little bit about dengue because it's an endemic problem. And from 2003-2004, we are seeing increasing number of patients with dengue every year, particularly during rainy season in July till September, October, we get this. And this is because of a virus from a Flaviviridae family. And it spreads through mosquito bite from Aedes aegypti mosquito bite. This mosquito bites during the daytime. And most of the children in the daytime are in the school. So most of the times the exposure happens in the school. And the virus enters in the body. And the incubation period is around 3 to 14 days. After that, the child develops high-grade fever. And there are 3 phases in dengue. So there is a febrile phase, critical phase, and then recovery phase. So generally, first 2-3 days, there will be high-grade fever. And then after 3 days, the critical phase starts where the platelets will start falling in the body. The rash comes on the body. The blood pressures may fall. The child starts leaking. There will be swelling on the body. And then after day 6, day 7, the recovery phase starts. Most of the times, in 90-95% of the cases, dengue is mild. So only high-grade fever with some rash. Platelets may fall a little bit and then they start recovering. So generally not very serious. But in 5 to 10% patients, it can be really very serious where the platelets can fall very badly and then child can bleed from everywhere and blood pressures can fall. There can be too much of leaking in the chest and abdomen leading to breathing issues, and it can cause involvement of the brain also, and the child can become really very sick.
Yeah. So how long does dengue last?
So generally that, as I said, it's around 7 to 8 days illness. After the mosquito bites, there is an incubation period of around 3 to 14 days. And after that, the illness is around 7 to 10 days. But if the child is very sick, it can go on for a long time also.
So what is the dangerous period in dengue?
Danger period is if it is becoming serious. Most of the times, as I said, dengue is only fever and then with mild rash and it recovers. But if it becomes a serious dengue, severe dengue, then the danger period is between day 4 onwards. So first 3 days only there will be a high fever and then the fever starts settling. Many times the parents think that child is improving because fever is settling, and at that time the platelets will start falling, blood pressures may fall. That is the danger period. So from day 4 to day 6, day 7, all these things can happen.
So how they are recover from this?
Yeah, so there is no specific treatment for dengue till now. There is no, like in bacterial infection, we give antibiotics and we kill the bacteria. For dengue, there is no medicine to kill the virus. So most of the times, only symptomatic treatment will be there. As I said, initially, most of the times it will be mild, high-grade fever with some rash, and then child recovers. So the doctor may not admit also into the hospital. They will just give some paracetamol and they will ask you to stay at home, take a lot of liquids, take rest. But if it becomes severe, if there is a dehydration or the low blood pressure, something, in that case you will have to be hospitalized and then managed in the hospital. And if it is only dehydration, low platelets, the patient can be managed in the ward. But if this is a serious dengue, when the blood pressures are falling, bleeding from everywhere, then these patients need to be managed in the ICU, proper well-equipped ICU.
Yeah. So what is the major role of a good pediatric intensive care unit facility in management of dengue fever?
Yeah, it's very important because if, first of all, early detection is very important. That's why we always suggest that between July to September, if any child is having high fever, 103 102, 103 onwards, where after giving paracetamol, if the fever is coming back within 3-4 hours again, think about dengue and go to a doctor early, first thing. And second thing, pediatric intensive care, well-equipped ICU is very important, because if the child is sick, particularly when there is a liver involvement, kidney involvement, brain involvement, then you really need a very well-equipped ICU where all the facilities are available, where you are able to handle the complications, you are able to get a good arterial line, you are able to get central line, you are able to keep the child on ventilator, you are able to support the liver failure, kidney failure, or brain injury, all those things. In most of the cases, this is not going to be required. So as I said, most of the times the children will be managed in the ward or a simple ICU. But when there is a multi-organ involvement and sick child, then it is very important that child is managed in a level 3 or level 4 ICU, where good facilities, well-trained nurses and doctors are available.
What is the best food for dengue fevers for recover early?
Best?
Food.
Food. Yeah, there's common misconception that eating papaya leaf abstract or kiwi food will increase the platelet count, but there is no scientific,
kiwi,
there is no scientific evidence for that. So generally we don't recommend. Sometimes these papaya leaf extracts can cause very bad acidity, and children can land up hospitalized because of acidity, not because of dengue. Right. So better to avoid such things. Yeah.
So is preventable?
Yeah, of course. Dengue can be prevented by avoiding mosquito bites, first of all. So, as I said, most of the times mosquito is biting in the daytime. The dengue, Aedes aegypti mosquito bites in the daytime. So, when we are sending the children to school, that time mosquito repellent should be applied on the body before you send them to school. Make them wear full clothes, full sleeves and pants. If the hospital uniform is not allowing full pants, I think the parents can talk to the school management and request them that during this period of July to September, at least they should allow full pants and full sleeves for the children. And mosquito control should be nice in the school. And dengue is more critical or more severe in children less than 1 year and more than 12 to 14 years obese, overweight children. So these children particularly need to take more precautions. So avoid overcrowded places and parks and those places, particularly these 3-4 months.
Yeah, coming to ECMO, doctor.
Yeah.
So what is the use for ECMO?
ECMO is extracorporeal membrane oxygenation. It's a very high-end type of support. So when the heart has failed or lungs have failed, then there is no way you can further manage the patient on normal mechanical ventilation, normal ICU treatment. So in that case, the only option remains is give rest to the heart or give rest to the lungs till they heal. So then you keep the patient on a machine called extracorporeal membrane oxygenation, that is called ECMO. So this was actually first invented for a newborn baby called Esperanza, which was a Mexican child. It was invented in America for that Mexican child called Esperanza. Esperanza means hope. So this was the first child who was put on ECMO. Later, it was less used in children and more used in adults. As you must have seen during COVID-19, yes. ECMO was used for so many adult patients, and celebrities like Jayalalitha and singer S.P. Balasubramaniam, they were also requiring ECMO for their COVID-19 illness. So ECMO was popular in adults, but in children also we use ECMO. In last 3 years, we have used in around 30 patients and with very good results. So when the heart has failed, then we use a special ECMO called VA ECMO, where the heart is given rest and the child is kept on a machine where the machine takes the work of the heart till the heart recovers. And if the heart is not even recovering, suppose then if we are going for a heart transplant, till that time this ECMO machine is going to support. And if the lungs are very bad, like in COVID-19 pneumonia and in viral pneumonias, then VV ECMO is done, where this ECMO machine takes over the work of lungs. And for 14 days, 15 days, we can keep the child on the ECMO. And in that period of 10-15 days, lungs will recover, and then we take the child back on the normal ventilator.
Right. So what were your most challenging cases, which you managed in your PICU?
Yeah. Last December, we had one child, 1.5-year-old child, who had a very bad viral pneumonia in Goa. And the father was a doctor, and this child was not improving in Goa, and they had called us. So my colleague Dr. Kapil Sachne, he had gone along with his team, our team, and they went to Goa and along with the cardiothoracic surgeon Dr. Sairam, and they started ECMO there in Goa. So it was very challenging because it was a government hospital and you don't have much facilities. And the team went from Hyderabad in air ambulance and they started ECMO there in Goa. And then after that, the air transported that patient. So they put along with ECMO machine and everything, that 1.5-year-old child in the air ambulance, brought the child to Rainbow Hospital. And here in our hospital, the child was kept on ECMO by our team for 29 days. And after that, the child recovered and went home. So he's doing very well.
Fantastic. Right, are there different levels of pediatric ICUs?
Sorry?
Which can manage a different level of sickness in children? ICU.
Yes, yes. So the ICUs are of different capabilities. That's why ICUs are divided into levels, level 1, level 2, level 3, level 4. So level 1, level 2 ICUs are basic ICUs. So where if a child has got simple pneumonia requiring some oxygen, some HFNC or CPAP, you can manage in level 1, level 2 ICUs. Level 3 ICU means you can manage these children up to mechanical ventilation. You can intubate, can keep them on artificial ventilation. Level 4 ICU means where you can manage ECMO or liver transplants, kidney transplants, bone marrow transplants. These are all under the category of level 4 ICU. So our ICU at Rainbow Children's Hospital, Banjara Hills Road number 2, we have a level 4 ICU. So we do ECMOs. We also take care of liver transplant patients and kidney transplant patients, bone marrow transplant patients. So last 3 years we have done around 50 liver transplants also successfully and managed them in our ICU. So that's what it is, a level 4 ICU.
Yeah. Could you please share with us your good experience in your career, challenges like?
So yeah, many challenges. Almost on daily basis we get challenging cases, and that's what keeps motivating us. This ECMO patient who came from Goa, that was very challenging. Then there was one child who had come from school. In the school there was a turpentine, there was a chemical, and this child had ingested that and developed a very bad pneumonia. And then this child had lungs were completely gone. So we had to put this child also on ECMO, and I think this child was on ECMO for almost 22 days. And after that, the child recovered, and child was in the ICU for total around 33 days and went home. So that was also very interesting and challenging patient. Recently, we had a liver transplantation child also who was very challenging. Post-liver transplantation. Before liver transplantation surgery itself, the child was very sick. Child came in acute liver failure, and we had to do a lot of hard work to stabilize this child first. And then we had taken this child for liver transplant. And after liver transplant, the child had lots of complications, lots of issues, lots of problems. And we sailed through all those things, and child improved and went home.
So can you give any suggestions to our medical students?
Yes, enjoy your work and try to be better and always be useful to the society. That's what. Try to be useful all the time.
Yeah, thank you. Thank you so much for joining with us, Doctor.
Thank you.